Hello, my name is Felicity. I'm going to be the nurse practitioner student today. May I examine you today?
Yes.
Alright, so the first thing I'm going to have you do is remember 3 words: wallet, car, and keys. Can you repeat that?
Wallet, car, keys.
Awesome. Alright, so the next step, I'm going to inspect your head and also feel around for it. Okay, so inspect and palpate here. Okay. And the next thing I'm going to do is I'm going to check your lymph nodes, okay? So this is pre-auricular, post-auricular, occipital, tonsillar, superficial cervical, submandibular, submental, and supraclavicular. Alright, next step will be checking your thyroid. I will be placing my fingers around your neck, okay? Alright, just look up a little bit for me. Okay, can you swallow? Alright, I'm going to press here on your right side and feel. Alright, press over here and feel on this side. Alright, so the next step is your eyes. I'm going to palpate and inspect here. Any pain?
No.
Okay. There was a hair. Let's get that for you. Alright, so let's check your vision, okay? I'm gonna have you stand over here 6 feet. Alright, can you read this line?
LTFPH.
Alright, I'm gonna have you sit back down here. Alrighty, so I'm going to shine a little light in your eye. Look straight at me. Okay, other eye. Awesome. Okay, now I want you to follow my finger. Just move your eyes and not your head, okay? Alright, keep following my finger. Alright, now look over my right shoulder here. Look back to my finger. And look over my shoulder here to the wall. And back to my finger. Awesome. Alright, so I want you to close one eye for me. See if you can see my finger wiggle.
I can
Let me
see
know.
it.
Alright, how many fingers do I
One.
have? Let me know if you can see my finger.
I can see it.
How many?
1.
Okay. Other eye. Let me know when you see my fingers wiggle.
I see it.
How many?
2.
And let me know when you see my fingers wiggle.
See him.
And how many?
2.
Okay. Alright, now I'm going to check deeper into your eye. So again, some bright light. Just look at me here. Okay. Okay, now I'm going to check your ears, inspect and palpate. You know if you have any pain. Okay, so I want you to cover one ear for me first. Over here. Let me know if you can hear me. 1, 2, 3.
I can hear you.
And repeat what I said.
1, 2, 3.
Okay? Cover the other ear. And repeat after me if you can hear me.
A, B, C.
Alright, now I want you to include one nasal. Breathe in. Okay? Breathe out. Next, opposite side. Breathe in. Breathe out. Alright. Now I'm going to inspect your ear and your nose with this light fixture here thing. Okay. Go back here. Go look in. Okay. Back here. Look in. And check your inside your nose. Check this out. Look in. Change that out. Okay. So next thing we're going to do is look at your mouth. All right. I'm going to inspect here, and if you can open. All right. Looking in here. I'm going to shine some light. If you will, say ah.
Ah.
Say ah real big.
Ah.
Alright. Okay, perfect. Mal and potty score of 1. Now I'm going to check your tongue. If you can stick it out for me. Nice and big. Good. Up. To the side. Then opposite side. And down. Alright, speech sounds good. Alright, so next thing we're going to do is I'm going to look at your lungs and palpate, okay? So I'm going to look here in the front. So I'm going to palpate here. Any pain?
No.
Also, I'm going to check the back as well. Inspect first, then palpate here. Any pain?
No.
Okay. So the next step would be percussion. So I'm going to continue to have you face this way. Okay. Next is tactile fermentus. I'm just going to touch you here. And if you could, say 99.
99. 99. 99. 99. 99.
Okay. Now I'm going to auscultate your front and your back here. So if you would look here. Before I do that, let me just double check one more thing here. Actually, if you could take a deep breath in and breathe out, checking for chest expansion. Now, let me know if you feel any pain when I do this, okay? Any pain? Okay. All right, so let me check and listen for your lungs. Okay, deep breath in when I touch. Out. In. Out. In. Out. In. Okay. Now we're going to check your back. Okay, so deep breath when I touch my stethoscope to your skin. Okay. Okay, so you're gonna breathe regular, and now just say E, okay?
E. 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 E.
Okay, now I would like you to say 99 when my stethoscope touches, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, lastly, I'm gonna have you say or whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so now we're gonna go into the cardio exam. Okay, going to inspect and then inspect your carotids I'm going to palpate your chest. Run my fingers on your chest. Checking for thrills, heaves, or lifts. And then I'm going to palpate your carotids. Okay. Okay. Then I'm going to listen to your carotids. Okay. So now I'm going to listen to your chest. First with the diaphragm. You breathe normal. I'll lift this up just a little bit. And just have you lean forward real quick. Checking the PMI. Okay, sit back. Okay. Now I'm going to listen with the bell. So now I want to check your capillary refills while you're here. Okay. Check for edema here. Check capillary refill. Okay. And I also want to check your pulses. So move your wrist. Check your radial. Your knees. Both of you. Yourselves. Okay, perfect. I'll have you lay down. We're going to complete the cardiovascular assessment. Okay, so once again, we'll be laying down. I'm going to listen to your chest. Okay. Breathe normal. Okay, now I'm going to have you on your side. Just going to feel for the PMI here. Okay. All right. While we're laying down, I'll go next into the abdomen. So just be straight. All right. First, with the I know you're tired. Cover your mouth when you're not, please. I'm going to inspect the abdomen and then go into auscultation. Now I have to listen for the arteries. Iliac. And for more. I'm just going to feel here. All right, I'm going to percuss now. Can you hear me tapping here? I'm going to measure your liver here. So, okay, you can put your finger here. All right. Your finger here. I'm going to measure that. Okay. All right. Perfect. All right, so the next step is palpitation. I'm going to do light palpitation first. So it might be a little ticklish, but let me know if you have any pain, okay? Okay, now I'm going to do deep. 2 hands here. Okay, now I have to feel for your liver. So bear with me, I'm going to put my hand back here and then push in. Okay, I'm going to feel for your spleen here. Ribcage is right here, seems like. Now, check for your kidneys. Okay, good. All right, so that completes the abdomen. Now we're going to go into the musculoskeletal exam. All right, I'm going to have you stand up now. Okay. All right. So, if you can bend down, put your chin to your neck, push against me. Now look all the way up. Now push against me, push down. All right. Now look to your left. Push against me. And look to your right. Push against me. Now bring your ear to your shoulder. Push against me, lift up. Ear to your shoulder. Push against me. All right. So, let's see here. Back here. Any pain?
Nope.
Okay. Might as well just check your elbows as well. Any pain, tenderness? Any pain, tenderness? Okay. All right. So now I'm going to go into your shoulders. You're going to lift your hands all the way up. All the way up. Slowly back down. All right. Then all the way back up. Up. Down. All the way up. Back down. And all the way back. All right. Perfect. All right. So lift your arms up this way. Push against me. Push against me. Now lift up again. Push against me. Back, push back, and then push forward. All right. All right, so next we're going to check your rotator cuff. So you're going to put your hands back up, empty it like this, and stay like that. Push against me, push against me, push, and then back in. Okay. Then you're going to go like this, and the other side. Good. All right. So now we're going to do your elbows. So if you could go like this, elbows to the side, then bend them up like a curl, and then bend them back down. All right. Now back up here. Rotate, rotate. All right. Next, we're going to do your wrists. If you could bend them up, bend them down, bend them in, bend them out. Okay. We're going to check your strength in your elbows. Push up. Push down, push up, push down. Okay. Now go like this with your wrist. Don't let me push against you. Push down, push in, push out. Goes like this. Let me push you down. Go down against me, in, against me, out, against me. All right. Now check your fingers. Spread them. Don't let me press them together. Now push them together like this. Rotate. Don't let me pull them apart. All right, now we check your thumbs. Put your hands out. Tuck your thumbs in. Stick them out. Up. Down. All right, push against me. Push against me. Pull them in. Put them out. All right, good. All right, so since you're standing, we're gonna do your hips and your spine. So if you could bend forward, push against me. All right, bend back. Push against me. All right, to the side. Bend to your side. Push against me. Push against me. Oh! Alright, and then push against me. Alright, then rotate. Push against me. Rotate. And push against me. Alright, good. Alright, so now into the hips. Alright, check for any pain. Alright, now if you could hold on to this, we're going to check your right leg. Bring your leg forward, bring it back, bring it to the side, cross it over your leg, and then bring it to your knee, and then extend it out, and then bring it to the middle. Yep, just like that. All right, opposite side. We're gonna do left leg, yep, out, backwards, to the side, forward, cross it, then bring your foot to your knee, then expand it, out, and then back in. All right, we're gonna have you sit down and check your strength. All right, so if you could lift up your legs, pull them down, push against me, push against me. All right, check your knees here. Any pain?
No.
Okay, now extend your legs out, bring back in. All right, now we're gonna check your strength. So if you could, push against my hands, pull against. All right, let me see your ankles here, your feet. Okay, any pain?
No.
Okay, so if you could with your ankles, bring your feet all the way to the front, all the way down, in with your toes, and out with your toes, in with your heels, out with your heels. All right, now we're gonna check your strength. Push against me, push against me, push against me, push against me, push up, push down, in, out. All right, since you're here, I'm gonna check something. I'm gonna check the Babinski reflex here. Okay. Since I'm still here, just gonna let me know if you feel the vibration.
Oh, I can feel it. I can feel it.
Perfect. All right, so now that concludes the musculoskeletal exam. Now I'm going to go into the neuro exam. All right, so if you would stand up. All right, do you remember those 3 words I've asked you to remember?
Wallet, car, and keys.
Perfect. And if you found a wallet, what would you do?
I would find its owner, or I would return it to the lost and found.
Awesome. All right, so we're gonna check your nerves here. The first one I'm gonna check is nerve 1, olfactory. So close your eyes if you will. I'm gonna have you see if you can smell this. And if you can't smell anything, let me know what you think it is.
Toothpaste.
Okay, perfect. Open your eyes. All right, so let's see. Next thing we're going to check is your reflexes. So let me see your arm here. Okay. Okay, let me sit down. You can go pull with both hands like this. Okay. Alright, so next thing, oh, I'm gonna stand up again. I'm going to check your cranial nerve number 5. So if you can just clench down on your teeth for me. Release, clench. Okay, cranial nerve number 7. I'm gonna have you smile, frown, puff out your cheeks. Okay, and have a seat. You can relax. So I'm gonna also check your sensory here. So close your eyes. Let me know if you can feel me touch your face.
Touch. 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 Touch.
Okay. I'm going to see if you can feel light or dull and sharp rather. This is dull, this is sharp. Okay? Sorry. You see?
Dull. Sharp. Dull. Sharp.
Okay? Alright. So now I'm going to have you open your eyes. I'm going to study your gait here. Okay, stand right here. Walk to about here regular. Walk back on your tiptoes. Walk back on your heels. Okay. Now come back over here. Have you turn around. Put your hands out. No. Okay. Like this. Put your hands out. Close your eyes while you're standing like that. Alright, perfect. Alright, looks good. You can relax, and that concludes the assessment.